Thank you for tuning in to the Brach Eichler Talks podcast, where we explore and discuss today's trending legal topics. In this episode, we discuss a recent healthcare law alert from Brach Eichler titled, New Jersey Healthcare Providers Face New Observer Training Requirements Starting April 18th. Here's what you need to know. Effective April 18th, 2026, certain requirements regarding observer training and qualifications will go into effect. On October 20th, 2025, the New Jersey Board of Medical Examiners amended its long-standing observer regulation to strengthen patients' rights and clarify licensee responsibilities when an observer is present during breast, pelvic, genital, and rectal examinations. While much of the amended regulation took effect on October 20th, 2025, the observer training and qualification requirements go into effect on April 18th, 2026. As of April 18, 2026, a qualified observer must have provided the licensee with documentation of successful completion of the CP2 training course for as-needed chaperones or a course of comparable scope and rigor approved by the board, and a written affirmation that the individual has not been subject to discipline or civil or criminal liability for failure to report misconduct or been convicted of certain disqualifying criminal offenses. An observer may not be a friend or relative of the licensee or the patient, although this does not prevent a patient's friend or relative from being present at the patient's request. A licensee must inform the observer in writing that the observer must remain in the exam room and be free from distractions, maintain a clear line of sight to the examination, report any suspected misconduct to the board, and that the licensee may not retaliate against the observer for reporting suspected misconduct. The observer regulation applies to all locations where licensees provide services other than a healthcare facility licensed by the New Jersey Department of Health. Licensees and practices should take the following steps to ensure compliance. 1. Confirm that all individuals who serve as observers have completed the required CP2 training course or an equivalent course approved by the board and have provided the necessary written affirmations. 2. Update written notice forms and post the required notice conspicuously in all applicable locations. 3. Develop or update internal policies and procedures governing observer qualifications, documentation, and reporting. And 4. Maintain records of all observer training, affirmations, and written disclosures for production to the board upon request. For more information, contact John D. Fanburg, Esquire, Managing Member and Chair, Healthcare Law at jfanburg at bracheichler.com or 973-403-3107 or Edward Hilzenrath, Esquire, Member, Healthcare Law at ehilzenrath at bracheichler.com or 973-403-3114 or Erika R. Marshall, Esquire, Counsel, Healthcare Law at emarshall at bracheichler.com or 973-364-5236. Don't forget to subscribe to our podcast on Spotify, Apple Podcasts, and YouTube. Follow us on LinkedIn and Facebook for updates on new episodes. For more information and resources, visit bracheichler.com. This is intended to provide general information, not legal advice. Please contact the authors if you need specific legal advice. Brach Eichler LLC is a full-service law firm based in Roseland, New Jersey with over 80 attorneys. The firm is focused on the following practice areas: healthcare law, real estate, litigation, trusts and estates, business transactions and financial services, personal injury, criminal defense and government investigations, labor and employment, environmental and land use, family law services, patent, intellectual property, and information technology, real estate tax appeals, tax and cannabis law.